Good morning, everyone. I am so excited and thrilled to be hosting this event. I want to welcome once again all of you in. You're trickling in, so we're just going to get started. I know there's a lot to cover in the next little while. And as we begin, I just want to start with this. We as women have so much on our minds and so much to accomplish. And I know that with the many chapters and stages and transitions that we go through as women, we also want to know how that affects us hormonally as well. Well, I know you've got the questions and we certainly have the answers. So you have come to the right place. Hello, everyone. If this is your first time seeing me, I want to thank you for welcoming me into your homes today. My name is Lisa Chang. I belong to the Cityline family, and I'm going to be your host for this event with the legend herself, female health expert, Dr. Marjorie Dixon. We are so honored to have one-to-one time with her. She is a busy lady, so to have that direct access is truly a gift. Now, I am here because I'm just like all of you. I'm looking for answers myself. 10 years ago, my life certainly isn't what it was or what it is today. And in looking at my life today, what I can say is with so much on my plate, yes, I do try and live holistically, but I can tell you, a bit of a confessional between us, is that I haven't always prioritized my sexual health and my sexual wellness as well, especially as a female. So I look forward to learning more about how to prioritize that as I approach my 40th year this year. I know I have a lot more changes to come, in fact, the bulk of them. So I want to know it all. Prevention is key, and so we're going to learn all about that once again with Dr. Marjorie Dixon. A big welcome to you, Dr. Dixon, also known as Marjorie, the legend herself. We have trusted our sexual and female health in your hands for many, many, many years, and thank you for helping thousands of families across this country. I know that we're going to go through a couple of different overarching themes today. But for starters, why do you think that this event was so necessary to have?
We have to talk about this more. We have to destigmatize this. I mean, people know I'm a fertility specialist, a reproductive endocrinologist, hormones are me. And wherever I go, I end up having inevitably a conversation about, like, I saw you and I have a question. And as the years have gone, my patients who have been in and out of fertility issues are growing their families. And now women are a little bit older having their kids. So they're starting the transition in their fourth decade, which is the average, but now surprised at actually what's transpiring. So it's time to destigmatize it. We have to rip the Band-Aid off and go and talk about what's actually going to happen. I'm going to make you know all about your vagina by the end of today. And I'm also going to make you understand about menopause, and it's not the time for a vaginal funeral. We can actually enjoy sex and life and intimacy after we've transitioned hormonally. So that's what we're going to talk about today, openly.
Yes, and this is the thing that I absolutely love, and I really do want to call out Cityline for developing a platform that is so progressive and inclusive for everyone to talk about the things that aren't generally talked about. So again, to have that one-to-one access with you is absolutely incredible. I can tell everyone that's watching right now that in the couple of weeks that we've had our own phone conversations, I have already learned so much, and I'm already putting so many things into practice. Before we get started, I do want to give a special shout out to our sponsor of this event, who is Replens. And Replens is the #1 physician recommended vaginal lubricant, and they have many products across the board to support your vaginal needs. So I know we're going to get right into how to use Replens products and all the different stages and chapters and things that we need to keep track of down there. But before we get into that, I want to just get right into finding out the differences between perimenopause versus menopause and the signs and symptoms that go along with both of those.
Okay, so perimenopause is around the time, that's what peri means, around the time of menopause. Menopause, formal definition, is 12 full months of not menstruating. So we are considering our reproductive lifespan somewhere, we get our first period around the age of 13 and then we keep menstruating pretty regularly, more or less, through our reproductive lifespans. Then by the time we reach our fourth decade, so around the age of 40, that's where we're entitled to have some spacing, some regularity in the periods, but then they come back. And sometimes they're heavier and sometimes they're lighter, but then they come back and they keep happening. The 5 years into the average age of menopause, which is the age of 51, so that's the average age of menopause, 5 years before that's around age 46, and for some women earlier, there starts to be some irregularity, heavy, light periods, and then a whole slew of symptoms. So the first thing around menopause and the perimenopause is irregular periods. So people will often say, I don't know what's happened to my period. Maybe I'm pregnant. I'm like, it's perimenopause. This is supposed to happen like death and taxes. Your cycles will get irregular and then go away. Okay?
The best analogy.
So, it is what it is. So that's the first thing, menstrual irregularity. Then another one is changes in your vaginal lubrication, moisture, and your libido. So whereas women might have had more sexual thoughts and thought had been interested in sex a little bit more often, it kind of starts to slow down, or it can slow down. There are things you can do, but that is something that you recognize. And then dryness. Women will say, like, I don't know, I don't lubricate the same way I used to, and it's dry on the outside, it's dry on the inside, and I think there's something wrong with me. I'm like, meh. That's just part of what we call the genitourinary syndrome of the menopause. To be expected. We'll give you pointers to do for that. The other thing we see on TV, people talk about, like hot flashes. People like all of a sudden temperature surges because when estrogen goes away around the time of menopause, our ability to regulate our temperature changes as well. And therefore, people have hot flashes, night sweats, chills. So that's part of what we call the vasomotor symptoms. And then there are the lovely mental changes. So you can get irritable, and people who you thought were okay are just a pain in the butt all the time. You can start your concentration. You can start memory. You're like, I put the keys somewhere. I'm pretty sure. I never used to do this. Why am I doing this all the time? Because there are mental changes that happen with menopause when estrogen goes away. So every place in the body that estrogen plays a role, which is a lot of places in the female body, then has like withdrawal because you're not making eggs that are producing estrogen anymore. So estrogen is like our body's crack. You take it away, we Jones for it in different ways, and it manifests itself in those different areas. The one last thing is, as we age, there are also body changes. And this one is really brutal for women. And I think that it interplays with all the other things is weight gain, hair loss, skin changes. When estrogen goes away, it affects collagen in your face and collagen in your vagina, by the way.
Wow.
Fat distribution in your face and in your vagina, by the way. So all of those things are going to start happening. And there are things that you can do because now we are talking about it. Once you start to see it in the beginning, now you can change the prodrome and you can actually change the experience of it. Knowledge and then doing something about it will make it not get to the end before you rein it back in. It's preventative medicine. We're not here just to treat.
And I'm so glad that you mentioned that it is preventative. That's the whole reason for this chat. And it's also about, getting ahead of the curve. And that's exactly why I am watching today. I do want to address a couple of the different comments that we're getting in the chat right now. We are seeing your questions. So yes, we are going to address all of that. Stephanie, I want to let you know your question was incredible. I do have it jotted down here. So we are going to address it today, as well as Nadia. I see yours as well. And with everything that you just said, Marjorie, it's interesting because all of the different signs and symptoms you talked about, all of the different questions we got, whether it be on email or Instagram, they all fall within those categories. So I think the first thing that we want to get to, and we got a lot of questions around it, is let's not beat around the bush. Pardon the pun. We're going to get right into vaginal health. All right. Did you like that one? Did you like it?
Touche. Like, that was good.
All right. First things first. We had a question about the term vaginal atrophy. What is it?
Yes.
And how do you treat it?
Okay. So vaginal atrophy is referring to the clinical manifestations, the symptoms that you have at the level of the vagina once estrogen goes away and things shrink up. Atrophy. It sounds like a superhero term when you take the fluid away and they all shrink up and die. It's not going to die, but that's kind of what happens. So when estrogen goes away, I was mentioning earlier how collagen works in the vagina, how Fat works in the vagina. If you've ever taken your fingers and stuck them in your vagina, because you can when you're putting in a tampon or for other reasons, you'll recognize that when you're younger, it has those nice like rugae, it feels irregular inside, it's moist. That's a well estrogenized during your reproductive lifespan vagina. At the time of the perimenopause and menopause, as estrogen goes away and the amount of estrogen that's available for your tissues goes down, the tissue actually responds to the lack of estrogen, so it shrinks. If I look at a vagina of a menopausal woman, I can tell the difference in her vagina because it becomes smooth. You lose all those rugae. It becomes less moist because all the cervical glands are responsive to estrogen, all about estrogen going away. So the genitourinary syndrome of the menopause, which is manifested with that shrinking of the tissues and drying up of the tissues, is what we call vaginal atrophy. And that's manageable. So you know how you think about your face every day? When I was young, one woman said to me, like, the one thing I'll tell you about aging is use good face moisturizer every day, even when you're young,
yes,
so that when you get old, you'll reap the benefits. I quote her for the vagina. So think of your vagina every single day. Do not take her for granted. I mean, I guess you could call your vagina he, but don't take it for granted. And moisturize. So there is something, you can get them over the counter. It's first-line therapy as gynecologists. We always tell people try those things if there's no pathology first that you can do. Pharmacy, over the counter, you get a vaginal moisturizer, not lubricant yet, a moisturizer. And you do that every day. At the first hint that you notice it's getting kind of dry down there, and even if it's not, you're like, I'm super moist, but I'm not going to let that get to me. I'm going to start my vaginal hygiene regime. And you go to the pharmacy and you get an over-the-counter like a Replens. You go and every single day you do that. And then for your big moments of intimacy, when you're going to have penetration, intercourse, whatever, that's where you use a lubricant. So moisturizer interspersed with lubricant. Get it? Interspersed with lubricant for the big moments of intimacy. And then there are also things that can help you actually over the counter as well. So if you feel dry on the outside, because women aren't all cookie cutter and all the same. So some people are dry on the inside, some people are dry on the external area. And you can get those over the counter too. They're moistening gel. So there are things that you can do baseline. And then that's not the only thing. That's first. We add that to, if it's still not helpful, then you have some hormone that you can add in that's locally administered to the vagina, cream, pill, rings sometimes, that just gives you enough estrogen to keep those tissues moist enough so that you can then enjoy penetration and sex again.
And so for those things, is that prescribed or are those things that you can get readily available as well?
So those ones are prescribed by a physician, which is why it's so important to talk to your physician. So the things that you can get, and we have to not feel nervous or embarrassed about it. We have to, like, as I said, rip the Band-Aid off the stigma. Go to the pharmacy, throw it in your cart. Don't worry about it. Be like, I'm taking care of my vagina today as you get to the cash. So that's one. Drive it to the cash, drive to cash. So that. Then you can get a prescription from your physician for the stuff that's estrogen, that's additional, that actually can help reverse the changes that I said happens in the collagen and the fatty deposition and the blood flow to the region that decreases when estrogen goes away as well. That's hormone.
Okay.
There's more. So you could also, when I talk about estrogen going away, there's less blood flow to the area as well. And we talked about the clitoris, and we didn't talk about it yet, but the clitoris is the most innervated organ of the body, more than a gland's penis. Our joy organ has more innervation than a man's, just to say. And so, but that also diminishes, blood flow to all those regions diminish around the time of menopause. And so there are therapies that you can do, like laser therapy to the vagina to help replenish that blood flow. There are stimulators or orgasm enhancing treatments that you can have for the clitoral region. So those are other things you can do to help with the atrophy at the vagina. And finally, we kind of talk about the things that you can do as a couple, because now I'm making it all really technical.
Yes.
And talking about the technicalities of the moisture and the lubricants and the gels and the hormones. But, you have to talk to your partner. If you're not getting along, nobody's going to want to have sex with anybody, right? So,
absolutely.
There's couple therapy, and then maybe your needs and your sexual needs were in evolution through our lifetime. We're not the same people we were 2 decades ago. is to talk about what you know works for you, as opposed to be expecting your partner to figure out the GPS to you. Sometimes people need direction, right?
Absolutely.
So how can you work on those things together? There's pelvic floor physiotherapy. So there's so much, and you can use all those things in an amalgamated way to make your ability to manage that vaginal atrophy and fight it and work through it so you can get to the other side, because sex post-menopausally can be very enjoyable. You just got to work through this time.
I mean, talk about the big aha moment already in this event. The comparison between a skincare regime versus a vaginal health wellness regime is just like, makes so much sense to me. And I think that you brought up a really great point, is that speak to your doctor, speak to a community that can support you, or who you can go to that can give you the answers. Because I think as women, we generally try to find all of the answers all on our own, and we try to fix it all, and we're prioritizing everybody else. And before you know it, your mojo is completely, I'm not even going to call it in the back seat. Maybe not even in the trunk. It's like on the curb, waiting for the bus.
Not in the car, but left it in Arizona. Like,
exactly.
It's very important. And I think that you touched on a really great point, Lisa. It is that women take care of the universe around them and keep calm, carry on, feel tremendous guilt if they're healthy, in other words, vibrant, and their kids are great and their partner's happy. And then they're like, but my vagina's kind of dry. Oh, whatever. Right?
Yes.
Or this can't, maybe something's wrong with me, and I'm kind of embarrassed about it. So I'm like, oh God, stop. Talk to me about your vagina. I can help. We can help. And I think about it from a societal perspective. So like the average life expectancy of women a century ago in the early 19th was like 40, 50 maybe.
Mm-hmm.
So this is probably the second or third generation only where we are as women going to be going through menopause in a large scale group of women.
Wow.
And still
so true.
Think about it, right? Right? So hashtag truth speak. But when you do that, you recognize that we have to talk more about it, because my mother would never have had this conversation. She's mortified I'm saying vagina so many times publicly. And then, right? And
my mom is watching right now.
Yeah, my mom's not. Whatever.
My mom's comfortable with the VJJ talk, I think.
It's all good, but I think that the destigmatizing of it, I mean, we teach people contraception, we're trying to teach people conception planning, because women are waiting longer to have babies. And it's not even just the menopause, perimenopause. It's whenever there's a point in your life where estrogen pummels.
Yeah.
Right? And so that can impact all of these organs of your body, and you have to understand how to maintain yourself.
Yes.
For future use.
Absolutely. And thank you once again for making it so approachable for all of us. I know I've spoken to you about the fact that I'm transparent. I'm an open book with everybody. I may be considering expanding my family, but I'm going to be 40 this year. And the first thing that I hear is, oh, that's a geriatric pregnancy, or, oh, that's, this and that, or it's not possible. So really for me, it's always been about getting ahead of the curve, living holistically. It's interesting to hear from your perspective that living holistically also means prioritizing your sexual health. And so many of us do not even think about that. It's the last thing on the list. So I would like to stay on the theme of vaginal health. And now we're going to get into sex, because a lot of our viewers are wondering why their sex drive is just completely low on the scale, or completely diminished in its entirety. They have painful sex. They have a complete loss of orgasm. One viewer actually asked how to be intimate with their partner if they don't want to have sex at all. Is that even a possibility?
Oh gosh. Okay, so those are big questions. And so from my perspective, and what I learn from my patients over time, is that not every woman is the same, but the main theme is it's not abnormal to feel burning if you're not lubricated and you're having intercourse. It's friction. And as the estrogen goes away, the tissues of the vagina, become thin and shrink, but they also become more fragile. You can even bleed during sex if you aren't having the proper regime or approach to it. And that's why it's so important to talk it out and to figure out what works for you. And so can you be intimate with a partner without sex? I'm not sure if that means without penetration, or if you can be intimate with your partner on different levels. Listen, I'm not a sex expert. I'm a gynecologist who sees a lot of women who talk about sex or not having it. What I do recognize is sex is much more than just the act. It is a lot of, we are complicated beings, we women, and getting into that place requires intimacy, requires communication. If you're irritated because estrogen's gone away, and you're frustrated, and you're flushing, and you're sweaty, you certainly won't feel like being intimate with anybody. Mm-hmm. But if you prioritize your intimacy, you will find a minute where you feel comfortable with yourself, and you have to work it into, and this is what the sex therapists always tell patients, you have to approach it like a regimen. If you are not having your sexual thoughts anymore, which is normal, by the way, because estrogen goes away. And remember, as I just said, from a societal perspective, this used to be the end of our lives, right? And now we're transitioning and then wanting to function well on the other side of it.
Right.
So talking with your partner, understanding the moisture every day, the moisturizing and the lubricants that you bring out for your intercourse moments or for penetration moments. Talking through, if it hurts, say stop, let's regroup. Yeah. Like, you don't have to just show up. The era of like the wife, dinner, whatever, sex, lay down is gone, thank God. And so it's important to, what the sex and couples therapist will say, biofeedback, pelvic floor physiotherapy, understand how to focus on the areas that will make you feel more like it's enjoyable, because nobody wants to have sex if it hurts. Right. And talk to partners too about changing it up, because if physiologically, this is not just menopause, like if patients have had treatments for cancer, radiation and chemotherapy to the genital area, it dries up, a vagina can seal shut. And then it's not that you have to stop using it. There's something called a vaginal dilator that slowly but surely can be used to open it up, along with the lubricants, along with some hormone locally if we can. So there is a way to get back to enjoyable sex, but you have to modify and communicate openly and know yourself first, by the way, because how many people coming out of this pandemic, and you brought this up when we were talking, am I still in your fire? It was bringing me to the place where people haven't been having sex. We've been in isolation.
Steal all the fire, bring it, because it was the first thing that I thought of was, we're starting to get out again. And I think some of us are feeling a little apprehensive about being social, much less having the bigger moments, like you were saying, and being sexual with a partner. And for some of us, we're just reapproaching our bodies again in that perspective. So thank you for bringing that up. I do want to acknowledge as well that you brought up medical situations like breast cancer as well. We have a lot of questions around sort of preemptive conditions like diabetes and heart conditions and surgeries as well. I know Nadia dropped a question in here as well on that. She just went through a procedure and how that affects your vaginal health. So we'll get to all of that. But let's just touch quickly on what your advice would be for anybody that's sort of re-entering the world of sexual wellness after COVID.
Okay, so one, if you're re-entering the world, make sure that you practice safe sex, because you can still get all kinds of diseases, number one. Number two is know yourself alone first. A lot of women are like, well, I'm not in a relationship, so I'm not really worried. I'm like, girl, you got to take care of your vagina all by yourself. Know what works. Know if she's dry. Know what changes are happening, because you need to maintain your regimen whether you have a partner or you don't. Because otherwise things will change and you'll get to the point where it's more difficult to bring things back. And so I will routinely tell single patients, I'm like, you need to still know what's going on, what makes you tick, how things are changing. They're like, really? I'm like, yeah, absolutely, because the physiologic changes will happen. But if you're going to enter back into the world, you have to kind of still feel it. I guess it's like riding a bike, what do I know? But at the end of the day, you have to understand how you work, what you're comfortable with, before then you start meeting new people.
Yeah.
And that's going to be an interesting thing. And then make sure people are vaccinated. That's the doctor.
That's a doctor in you.
Statement.
Okay.
The doctor and me, make sure people are vaccinated before you
Okay.
venture.
Well, I just want to say that so far, this has been an incredibly empowering conversation. And I would love for all of you to drop a line on whether or not you're finding this conversation incredibly helpful, educational. That was the whole point. And Marjorie, when we were having all of our technical issues in the beginning, that's exactly how I introed this event. We really want you all to feel comfortable to ask your questions. We are monitoring all the questions that are coming in. In fact, a big shout out to Cassandra and Talia on the sidelines as well. They are also taking your questions. We are going to be here to answer all of the questions under the overarching themes. However, if we run out of time, I just want you to know that we are going to be answering every single one of your questions directly. So nothing will go unnoticed. It will all be answered. All right. So we are going to get to the next very important topic, which so many of our girls are looking to get more of, and it's not sex, although some are looking for that. It's sleep. Marjorie, our girls are sleep deprived. Oh my gosh.
Yes.
So they're having the hot flashes, they're having the night sweats. How do we improve quality of sleep? If you are in peri or menopause, and I also just want to say that I'm noticing that there is a few different commonalities in what you're saying, which a lot of it goes back to mindfulness. Does mindfulness have a part to play in sleep deprivation as well?
Not so much. I mean, initially people are a little bit different. Those are the vasomotor symptoms that are really pervasive and problematic. They're probably the number one reason people see gynecologists, less than the vagina. People are like, whatever, my vagina is, I'll have a funeral, rest in peace. Let's just keep me cool. Okay. That's what kind of happens. And we've gone from this place, I've been in practice for 20 years now. So we went from the place where we put the estrogen everywhere. We're like, put it in the water. It's hormone replacement's great. Until we discovered through the Women's Health Initiative that there are some potential side effects that we don't want by putting people on hormone therapy. But the most effective way of treating those flushes and whatnot is hormones. But how do we lifestyle manage it? And sometimes with a selective serotonin reuptake inhibitor, sometimes with some of the medications that we use for depression and anxiety, those can actually be helpful for hot flashes and effects, surprisingly. But when I talk with them, I always talk about first-line therapy, conservative stuff. We don't always go to the medications, right? And so you wear pajamas that can wick off the sweat, right? So like cotton, light pajamas to bed. I have, one of my patients said the best thing her partner ever did was buy her a fan with a remote control. Oh. And so when she would be having one of these flushes, she could use the remote control and Bob's your uncle, fan starts, help to cool you off. Those are using cotton sheets, like things like that you can help. And then dressing in layers as opposed to, because we live in Canada where there's winter, it's not like in the Caribbean where you can wear light clothes all the time.
Or nothing.
But here, yeah, or nothing, whatever, skinny, it's all good. But you can actually take layers of clothing off so that you're accustomed to the feeling cool, feeling hot, because as we said before, estrogen goes away, that thermoregulator is all over the place. And it lasts for about 40 seconds, sometimes up to a minute. People feel awful. Drink some cool water, walk around, get up. It disrupts your sleep. So if it becomes really disruptive and you're not sleeping, that is like the vicious cycle, and you become even more irritable, and the people around you who you thought were pests become even more of a pest, and then you have trouble at work when you're trying to function, your kids. So if it becomes that bad, you don't just have to live with it. Go see your doctor. In the early part of your perimenopausal transition and into the menopause, sometimes taking some hormone therapy systemically, so by mouth, can be quite helpful to quell those so that you can function. The problem is when it disrupts people's activities of daily living, you really have to deal with it. Don't feel like you are failing in any way, shape, or form. Your estrogen's gone away and your body's having a fit. And so talk to your doctor about it and see what can be done. The other thing is exercise, stay at a fighting weight, because it's hard once we get into the menopause. Talk about the freshman 15s.
Yes.
People get into menopause. It's the menopausal 15.
Oh.
It's all menopausal. I know.
Comes back. All right.
So you got to fight that, because the heavier you are, also the more estrogen you make in your tissues, then the more the withdrawal and the flashes become the more intense.
Makes so much sense. All right, well, that's a good segue, because my next theme was going to be mood and body changes. So I just want to give a big shout out to our beloved Tracy Moore, who also submitted a question. I promised her we were going to get to it, and told her we have her back and we have her front. So the question from Tracy was, please ask Marjorie why I have fits of rage. I used to be so sweet. She knows my periods have gone haywire. I just want to be nice again. So let's talk about that, because some of our girls as well wrote in about mood changes, depression, migraines, all of that. And then, of course, the body changes you were just talking about. They're uncomfortable.
Yeah, it's all estrogen's fault. Our estrogen went away. Estrogen goes away, and that withdrawal can exacerbate anxiety, depression, and fits of rage. I don't know about fits of rage, but I
told her
honestly, yeah, we'll blame it on the estrogen, but the changes in your mental health are quite marked, and women are surprised by it. Usually it settles down into the postmenopausal stage. People will be like, I was nuts for like 3 or 4 years, and then I seem to have found ways of managing it. And so this is the holistic things that you have to do. It's not always the other person. Sometimes it's us, and therefore we have to manage. So meditation, exercise, trying to sleep, managing the symptoms that prevent us from sleeping. So the fans, the wicking, the light sheets, and yeah, it's hard to manage the change. And I think that we also internalize okay, so now we can't have children anymore, and so this is part of the womanhood that then we're moving past, and that has a tremendous strain on some women. And women can get depressed.
Yeah.
And we have to acknowledge that as an issue and manage accordingly. Like if you do get depressed, then you talk to your doctor about, whatever can help. And SSRI might help your flashes and depression.
Mm-hmm.
And then the headaches also, she mentioned headaches. I think somebody said headaches.
Yes, we had a question about migraines.
Some women actually get headaches routinely at the beginning of their cycles when estrogen goes down. So I've shown before, when I'm talking about as a fertility specialist, ovulation induction, and how your estrogen and your hormones go up and down and up and down. You ovulate, then it goes down again. There's that nadir, the low at the end of your cycle right before you get your period. You're at risk of getting headaches. Well, then when you go into menopause, your estrogen's gone. Your headaches can go full haywire. And so that too will need to be managed. So do you do it conservatively, sometimes with stuff that you take for headaches, like acetaminophen or ibuprofen?
Right.
Or do you, as someone is transitioning, because it's usually through the transition and early menopause stage, then after you get into the later postmenopausal stage, things kind of settle in.
We had a question that just came in from one of our viewers here on the chat that asked, how long does menopause last? And I'm curious to know, how long does perimenopause last, menopause, and then post?
Okay, so what the studies have shown is that it varies, but that on average, the perimenopause transition into menopause is kind of 4 to 5 years. So you go through your life where, you have your estrogen waxing and waning, it does this, and then into your 40s, it kind of does this, and then it starts to do this. And then the average age 51 is like 46 to 51. 51 is where it reaches its nadir. And that's because the eggs in your ovaries that are making this estrogen are now depleted. Run out on the shelf, down to the bottom shelf. And so the postmenopausal phase is usually in the 5th decade of life. Now, patients tell me all the time, yeah, my mom had periods until she was 60. And I'm like, what? So there is a variation. But what I need to say here also, public service announcement, is if your periods have stopped and you are menopausal for 12 months, and that goes on for a year or 2, and then you bleed, you need to go have that checked. You can't ignore that, because postmenopausal bleeding is a sign of something else going on that needs to be investigated.
Got it. Marjorie, I just wanted to address a comment that just came in that called you an angel. And I have to completely agree. And she definitely calls out the fact that she has her two beautiful children because of you. And I have to tell you that on the sidelines, I was also getting DMs from several different people that let me know that you helped them begin and bring their family planning to fruition. And I have to say that while we are talking about taboo subjects, you are still very angelic in the world of what has often gone left unsaid. So while we talked about sex, while we talked about vaginas, yeah, girl, spread your wings because you're teaching us all the things that we need to know. We have a few of our viewers that wrote in on Instagram, specifically Linda and Candice, who wanted to know about dietary changes that they can implement if they have symptoms of menopause. We had a couple of questions about collagen as well. Any sort of supplements, anything like that that you would recommend that could help us sort of stay on top of it, be empowered, or even if you're in your 30s, help the prevention of some of the more serious symptoms?
Serious stuff. So that's a great question. I think that what I didn't touch on at all was what can happen to your bones in the peri and postmenopausal stage, because our bones, we deposit bones as women, we actually grow bone strength up until the age of 30 only. And after that, it's downhill. Okay. So unless you have a perfect diet where you have all of the supplements and your vitamin D and you're taking iron and calcium in a consistent way, you will not be maintaining, you will just be watching your bone health go down. There is, what you can do is weight-bearing exercise, and a supplement that has both iron and calcium in it will be helpful to minimize the exacerbation of osteopenia, so lowering of your bone density, and then eventually the risk of osteoporosis, which then would put you postmenopausally at risk of fractures. Okay? So that's one of them. Another one is, when we talk about how do you manage hot flashes or some of the symptoms, the irritability comes with things like that have been investigated, black cohosh or milk thistle. Unfortunately, there has been inconsistent data around some of that stuff. Isoflavones, which are similar estrogen-producing compounds, and soy, those ones, if in the right amounts, can actually help minimize symptoms as well. And so you'll see over the counter where it will say isoflavones or soy-based product great for menopause. Some studies have actually shown that if you eat enough soy, it will minimize some of the exacerbations.
Wow.
Yeah, so because it has estrogen-like compounds. So those are the types of things that you can add into your diet. Now you have to be careful. You have to talk to your doctor, because if you had other things going on, like a breast cancer, you don't want to be adding all that on your diet. So that's why it's so important to, on a case-by-case basis, talk through what your most pervasive issues are. Right. But when you're managing through the transition, the things that you want to do are eat wholefully and wholesomely. You want green leafies to abound. If it swims or if it flies, great. If it walks on land, and then also you want to minimize too much trans fats. So all of the things that we get off of the shelves that are super convenient for us are filled with things that are not so great for us, particularly when we are going into a time where we're prone to gain weight. Right. And so I look at it, and my counsel is to people, like my grandmother lived off the earth. And so if it hasn't been processed, and if it is organic, and if you can cook it in the simplest way, that's where you get the most nutrients out of it before we process it, right? Right. And I'm not a nutritionist, I'm not a dietitian. So I would encourage you, after we will go, and I will actually look up the evidence, because I talked about some of it being evidence-based and some of it being a little bit of hype. And I don't want people to do things that are not based in evidence, because I don't want to give people false hopes. But absolutely, the genius of nutritionists and some of our naturopathic physicians, doctors that we're working with, is to manage lifestyle to prevent the exacerbation of these things. And they know all about soy and isoflavones and supplements that you can do to optimize that. And what we'll do is make sure that we post that in the answers in the comments thereafter.
Fantastic. And I also want to acknowledge Rhonda, who is watching. She's one of our viewers and sharing such great information. Thank you so much, Rhonda, for staying engaged with us, and for all of you who have dropped comments. Now we're going to get into another overarching theme, which is medical changes. So you mentioned breast cancer. We have had a question come in around the fact that after menopause and breast cancer, our viewer was afraid that sexual urges will never come back. She wants to know, will it? Stephanie from Instagram, she was here at the beginning, and I encourage all of you to please stay until the end. We have such tremendous information still to come. She had her left ovary removed, a tubal ligation and ablation, and since then has had zero sex drive. Can that happen after medical procedures? So if you have procedures around your feminine body parts, how does that affect your sex drive? How does that affect menopause? How does that affect your hormones?
It depends. So when you have a pelvic surgery, if you've had pelvic surgery that resulted in the removal of your ovaries, so that's a surgically induced menopause, then you can have a very abrupt surgical menopause. And for some women who are having things like ovarian cysts removed, and they have their ovarian cysts removed in the later part of their reproductive lifespans, that can accelerate their move into menopause. And therefore, some of the symptoms of the libido drop, the vaginal dryness, the changes that we're talking about will happen earlier by virtue of the fact that the things that produce estrogen in our body from the ovaries have been removed. Taking a tube out, I love that you said tubal ligation. I'm like, that tube went to court. Tubal ligation.
Ligation, okay.
Tubes.
It reads
No,
litigation.
It's all good because actually sadly I know too much about litigation, but that's a whole other story. So yes, if you've had a tubal ligation, that should not impact your hormones or how you feel about sex, but it could be that when you have periods, because your tubes have been blocked or ligated, sometimes you feel more crampy around a period thereafter, so that might impact it. But when you've had something like breast cancer, it depends on, was it estrogen, was the receptivity, the receptor positivity or not. But once you've had it, if you've been treated with something called an aromatase inhibitor, which actually gets rid of estrogen around it, minimizes estrogen, that can already make the symptoms worse, and then add to it menopause, right? So that can be really hard, kill your libido, sexual thoughts, any sexual urges. You have to work your way back. And I actually had a postmenopausal woman who I worked with through the transition, and she was like, I said, don't give up, keep trying, do your moisturizer, do your lubricant, here's a little ring for some hormone, talk about it with your partner, go through some couples. That she had done everything, and she about maybe 3 years later, not came back to see me, but actually sent me a note at Christmas time to say, it worked, you have to push through, thank you. So it's pushing through, and talk to your postmenopausal friends, lady. They will give you pointers, and they will tell you, and they will give you hope also, that at the end of breast cancer, at the end of premature ovarian failure, at the end of your infertility treatments, you can still have sex for fun. You can still be intimate with your partner or just by yourself, but you have to have an approach to it, and you have to make a plan for it. It won't just happen. It'll be effortful. I'm like, you can't get to the sex Olympics without training. You know what I'm saying? So in a way, you have to make sure that you upkeep, that you keep it going, that you think about your vagina, and then find the right healthcare provider. Some doctors aren't great at talking about sex or talking about what needs to happen from a vaginal health perspective. So find the right physician, and then trial and error, don't give up, but everybody's a little bit different.
Right.
And so it's a matter of finding the right combination of therapies that will work for you to help you to get to the other side.
Okay. So if I'm hearing this correctly, it's all about developing that routine again of taking care of our parts with the moisturizers, the lubricants, and also being very communicative, which again, I think has been an overarching theme that we've been talking about as a solution. It's all about talking about it. And again, the fact that we're able to have this platform to bring a community of women together to share their own information and their own experiences is absolutely brilliant. I'm going to let everybody know we are nearing the end of the event. However, we do have one more theme to get to. If you have any questions that are remaining, we are happy to take them in. Just make sure that in the comment section of the Facebook page, you're entering your question. Again, our goal is to get everything looked at and all of your questions answered. So we are definitely going to do that. Last call for that. It's almost like I'm a bartender on a Saturday night. Okay, we are going to get into pelvic floor physical therapy. Is there anything that you would recommend around strengthening your muscles like pelvic floor therapy? Any type of exercises that we can do on a regular basis in addition to the routine that you've already addressed?
Right. So there's something called Kegels, and these are exercises. There's musculature to the pelvic floor and the perineal region. And I did one of these with Tracy where we tested out a thing that it was a device that links to your iPhone. And of course you can do it by yourself. So I tell everybody, okay, squeeze down there and then bring your elevator, pretend it's an elevator, bring it up to the first floor and then to the second floor and hold it and hold it and then go down to the first floor and go down to the ground level. And you practice. That's practicing tensing the muscles of the pelvic floor region. And that's also helpful for sexual enjoyment because when you're using your muscles around the perineal area brings blood flow into the region, right, Lisa?
Well, I'm still holding on the first floor right now.
Yeah, do it. You can do it on the bus. You can do it standing up. You can do it sitting down. But this device that I tested, it was Tracy some years ago. It was so funny. We were on the show and I tested it out and it links. And then you start competing with yourself. And it's like squeeze, squeeze, squeeze. And it links back to your phone and it shows you, did you do it? No, you failed. Do it again. And so you practice. And it's, again, building a routine around, okay, I'm going to make her understand how to react to what my brain is sending as a message to the area. So this stuff exists. So you can just do a regular Kegel routine. And that will also help with some of the stuff that happens with bladders, because I didn't mention that earlier, but you can actually lose a little urine and cough and sneeze and do that when you're doing your Kegels. That helps with some of that urogenital aging as well.
Fantastic. Okay, so we have some questions that have just come in from viewers around hair loss. So we did talk about body changes, weight gain. Let's try to address the topic of hair loss a little bit. How does that happen with menopause and how can we treat it?
So unfortunately, once you lose terminal hairs, they're gone. And so we have women who through pregnancy actually will attest that, you know, with the hormones that come from the placenta and all the estrogen, the progesterone, hair is like fantastic and thick and full. And then once the placenta goes away, all those placental hormones that were feeding your hair are gone. And so that's called telogen effluvium. You have to love Latin. But telogen effluvium is a concerted loss of hair. And that actually happens as we get into menopause with the lack of our estrogen. And so can we fight it? A little bit, but it is one of those things that happens to not every woman, but to a lot of women. They will note that their hair has thinned. And so preventatively, talk to your hairstylist, stop styling your hair too much. Maybe don't dye it as much. Maybe don't treat it as much. All of the things that we do to our body, you know, that have a strain on it. And when you are worried about terminal hairs, because as I said, we can't make hair grow back once you've lost the hair follicle. And dermatologists will do a good job of talking you through the things that they can do. Mm-hmm. If you have hair loss in a circle, that's a little bit different. That's alopecia areata. You might need some steroid injections into that. But you can also fight it. So if you're noticing that your hair is falling off a little bit more than it should be, go talk to a dermatologist. The dermatologists know all about hair, and they will tell you what it is that you need to do. But just take heed that it doesn't happen to absolutely everybody.
Right.
So some women have lovely locks of hair, even though it's menopausal.
Right. Okay. All great advice. We have a lot of comments that have come through. Many of our viewers have situations specific to them. So I do want to let those viewers know that Dr. Dixon is around. We are here to answer your questions. She will be here after the show. So we are jotting down all of your questions and we are going to get back to you directly. But with all of that said, I do want to summarize all of the things that we've talked about within this time that we've had together. We've talked about so many overarching themes, from vaginal health to sexual wellness to body changes and mood changes to how you can sort of get ahead of the curve with diet and exercise and all of those things, sleep deprivation, and of course, sex as well. We covered a lot of bases, and I know some of you are trickling in now. I want to thank all of you for spending time with us today. It's one heck of a way to start off your week, and I think, you know, just to touch on all the things, talk about the most empowering time that we could have as a group of women together learning from each other. Some of the questions that have come in is, where is this key information going to live, and is it taped? Good news, it is being taped. The goal is to have this living forever on the Cityline YouTube page. And if you want more of these types of group conversations and events, write in. You know that Cityline is notorious for bringing out information that we need, bringing up topics that we have to address and that we need to change in the world. So your voice is definitely heard. And Dr. Dixon, I don't know if there's any last parting thoughts that you have for everyone watching. We had a large group today, so they stayed with us the whole time. I know they took everything you had to say in. What would you want to leave us with?
Yeah, I think, you know, all joking aside, right?
Mm-hmm.
Like I think it's so important for women to not lose faith that their sex lives will dwindle or their libido will disappear. I mean, we had an open and candid conversation, but you don't have to have a vaginal funeral when you hit perimenopause and menopause. We will be, and I've said this before, your vaginal fairy godmothers. Look at this video, link to the information that's there. There are things that you can do to get to the other side and have a perfectly wonderful sex life and postmenopausal life. We've only lived half our lives into this point. Let's make the other half spectacular.
Yes. Talk about a way to end it. And you know, in the beginning, you said, name your vaginal parts. I'm going to say that you gave us an option to either name her or name him. And I am going to say mine as a girl all the way, because everything that you talked about within this conversation proves the fact that women have so much to juggle on a daily basis. When we came in and I introduced this event, that's exactly how I started it. We have so much to think about, so much that we want to accomplish, making everybody else the priority. And when it comes to ourselves and the bodies we live in, it's almost like I said, that goes in the back seat. So talk about just reminding everybody that we come first. And when our glass is full, everybody else's glass can be full too.
Yeah. Amen.
Brilliant conversation. I loved the time with you. I wish we had more time. One of our viewers asked if you're accepting patients. So
always.
There you go.
Always at another.
There you go. Talk about a blessing.
Thank you for having me. It's always fun to have these conversations. You and I, we chat, whatever. It's all good. But please, women, talk about it more. Talk about it at parties. Talk about it with men. Talk about it with women. Talk about it with people who identify as non-binary. Everybody needs to understand that there's an evolution to the vagina, but she will be just fine.
Things are changing for the better. We're bringing conversations to the table that matter. We're having the conversations that need to be had with the people that we need to have them with. So with that said, everyone, have a spectacular rest of your day. Again, know that this content is going to be living on Cityline's YouTube page. And if you want to see more, you know who to contact. Dr. Dixon, thank you so, so much. We just love you.
It's a pleasure. Thanks for having me. It was fun.
All right, everybody. With that said, have a great week. Have a great day. Bye for now.